Let us discuss the global and national health context. Our focus will be on understanding key health trends, patterns of disease, major challenges, and current health initiatives, both globally and here in the Philippines. In the global health context, we see the following trends emerging. We are seeing significant demographic shifts. The world's population is aging rapidly. According to the World Health Organization, by 2030, 1 in 6 people in the world will be aged 60 years or older. Urbanization is accelerating, with over half the world's population now living in cities, posing both opportunities and challenges for public health. We are also in the midst of an epidemiologic transition. While infectious diseases like TB and malaria remain concerns, non-communicable diseases or NCDs such as cardiovascular diseases, cancer, and diabetes now account for the majority of global deaths. Another critical issue is the rising burden of mental health conditions. Depression is a leading cause of disability worldwide, and the COVID-19 pandemic has exacerbated anxiety and stress globally. Climate change is increasingly recognized as a public health emergency. Heat waves, floods, and air pollution directly harm human health and are intensifying. Finally, despite progress in health, health inequities persist and even widen within and between countries. Addressing the social determinants of health is essential for achieving equity. Beyond these major trends, several emerging issues are shaping global health. Long term impacts of COVID 19 continue to burden health systems and society. Many countries are now grappling with long COVID and the backlog of care for other health conditions. Another serious threat is antimicrobial resistance, or AMR, which undermines our ability to treat common infections and perform life saving medical procedures. Food insecurity is worsening, partly due to conflict and climate change, affecting nutrition and child development globally. Mental health and psychosocial well being are under strain due to global crisis, displacement, and the lingering effects of the pandemic. Then, migration, whether due to conflict, economic pressures, or environmental change, is a growing health concern. Migrants and displaced populations face significant barriers to health care and experience disproportionate health risks. Let us now take a closer look at the global burden of disease. According to World Health Organization, non-communicable diseases now cause approximately 74% of all global deaths. Cardiovascular diseases remain the leading cause of death worldwide, followed by cancers, chronic respiratory diseases, and diabetes. However, infectious diseases remain a significant threat, particularly in low and middle income countries. Tuberculosis, HIV/AIDS, and malaria continue to affect millions. Injuries and violence are major causes of death among young people. Road traffic injuries, self harm, and interpersonal violence disproportionately affect those aged 15 to 29. Environmental factors contribute significantly to disease burden. Globally, 13 million deaths annually are attributable to avoidable environmental causes such as air pollution and unsafe water. Climate change is no longer a future concern. It is affecting health today. Rising temperatures contribute to health related illnesses and deaths, particularly in vulnerable populations like older adults and outdoor workers. Vector borne diseases are spreading to new areas due to changing climate patterns. For example, dengue and malaria are now appearing in regions where they were previously uncommon. Food and water security are threatened by extreme weather events and long term shifts in rainfall and temperature patterns. This has significant implications for nutrition and child health. Climate related displacement exposes populations to health risks such as poor sanitation, overcrowding, and disrupted access to health services. Addressing climate change is thus integral to safeguarding public health. Despite global commitments, health inequities remain a pressing concern. There are stark disparities in life expectancy across countries and even within countries. For example, a child born in Japan can expect to live 84 years old, compared to just 54 years in some parts of sub Saharan Africa. Access to vaccines and essential medicines remains highly unequal. The COVID 19 pandemic highlighted these disparities, with many low income countries still struggling to achieve adequate vaccine coverage. Socioeconomic determinants such as poverty, education, housing, and employment continue to drive poor health outcomes. Marginalized groups, including migrants, ethnic minorities, and people with disabilities, face greater barriers to care. Achieving health equity requires a sustained commitment to addressing these systemic and social barriers. Let us now shift our focus to the Philippine health situation. The country faces a double burden of disease. While communicable diseases such as TB, dengue, and HIV remain significant, the incidence of NCDs, particularly cardiovascular diseases, diabetes, and cancer, is rising rapidly. Health inequities persist between regions and across socioeconomic groups. Rural areas and geographically isolated communities often face poorer health outcomes and limited access to services. Maternal and child health has improved overall, but gaps remain in rural areas where maternal mortality rates are still unacceptably high. The Philippines is also confronting a dual nutrition problem. Undernutrition among children coexists with increasing rates of overweight and obesity. Meanwhile, mental health is a growing concern, with limited services and workforce capacity. Communicable diseases continue to burden the Philippine health system. The country is facing a high burden of tuberculosis, including multi drug resistant cases. The incidence of HIV/AIDS is increasing, particularly among young males and in urban centers. Dengue fever remains endemic, with periodic outbreaks affecting thousands each year. The COVID-19 pandemic disrupted essential health services and exposed weaknesses in pandemic preparedness. Emerging threats include antimicrobial resistance and zoonotic diseases, which require enhanced surveillance and coordinated response. Non-communicable diseases are now the leading cause of death in the Philippines. Cardiovascular diseases such as hypertension and ischemic heart disease account for a large proportion of mortality. Diabetes is rising, particularly in urban areas, driven by lifestyle factors and poor dietary habits. Cancers, especially breast, lung, and cervical cancer, present increasing morbidity and mortality burdens. Tobacco use, unhealthy diets, physical inactivity, and alcohol misuse contribute significantly to these trends. Non communicable diseases prevention and control must be strengthened through multi sectoral approaches, public education, and improved access to early detection and treatment. Mental health remains a critically underserved area. Common mental disorders such as depression and anxiety are prevalent but often undiagnosed and untreated. Suicide rates are increasing, particularly among young people. Addressing youth mental health is a national priority. Gaps in services and shortage of trained mental health professionals limit access to care. Stigma remains a barrier to seeking help, both in communities and within healthcare settings. Integrating mental health into primary care and scaling up community based services is vital for improving mental well being. The Philippine health system faces several structural challenges. Geographic and socio-economic disparities result in uneven access to quality health services. Health workforce migration and shortages, particularly in rural areas, strain service delivery. Out of pocket payments remain high, causing financial hardship and deterring care seeking among low income groups. Service delivery is often fragmented, undermining continuity of care and efficiency. There is an urgent need to build a more resilient, equitable, and integrated health system that can withstand future shocks and meet the diverse needs of the population. In summary, in summary, at the global level, we see a complex landscape of health challenges, from the rise of NCDs and climate impacts to persistent infectious threats. Here in the Philippines, the double burden of disease, health inequities, and system challenges require coordinated and sustained action. Both global and national strategies are moving toward universal health coverage and sustainable development goals. Primary health care and equity focused policies must be at the heart of our efforts. As future nurses and health professionals, we play a vital role in advancing health for all in our communities, our nation, and our global society.